Hi there, and welcome to A&P with Dr. O. In our video here, we're going to take a look at the histology of the urinary bladder, and we're going to focus mainly on the wall of the urinary bladder. Let's go ahead and get our bearings. One of the things that we're going to want to be able to find is the epithelium associated with the urinary bladder, which is the transitional epithelium. That means we need to find the apical surface. And if we think about epithelium and where that tissue is located, epithelium is always going to face some sort of a space. This could be an external space or internal space. In this case, we're going to be facing an internal space, that internal space in the urinary bladder that's going to temporarily store urine. So that's what we have here. This, if we can envision, this is the space where we temporarily would hold urine, and this then is the apical surface, making this our transitional epithelium. We can also visually take a look and see characteristics of that transitional epithelium as well, that specialized stratified squamous epithelium that expands that we talked about in A&P 1. I'll go ahead and mark this then as our transitional epithelium. And then that means on the opposite side, that's where we're going to have our visceral peritoneum. Again, if we think back to A&P 1, we talked about the different body cavities and organs associated with each body cavity. The bladder is found in the pelvic cavity, and also in the inferior portion of the peritoneal cavity. That means that the bladder is going to be infraperitoneal, and the superior portion of the urinary bladder is going to be lined with visceral peritoneum. In addition to our transitional epithelium, we also have the lamina propria, and that's going to combine together to make up the mucosa or the mucous membrane of the urinary bladder. If we find our transitional epithelium, then our connective tissue that is next is going to be our lamina propria. And again, these two together are known as the mucosa. And that's going to be helpful for when we look for the submucosa. Sub is going to imply below. And if we find then the parts of the mucosa, then we know that underneath the mucosa is going to be the submucosa. Next, we can see all of this smooth muscle here. We have this huge layer of smooth muscle. I'll go ahead and bracket that off for us. Again, all of this smooth muscle here. This smooth muscle has a special name, and it is called the detrusor muscle.